Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. Back with us is Dr. Sandeep Grewal. He's a board-certified internist who was given the 2013 Innovation in Healthcare Award by the Charlotte Business Journal. He's the founder of ACE Medical Group, named one of Charlotte's top 40 under 40, and he's the author of the book we're going to talk about today, Dementia Express: Lose Your Memory in 100 Ways. Dr. Grewal, welcome back to the program. It's great to have you with us.
Well, thank you, Rick, for having me on again.
Well, it's a really interesting new book, Dementia Express: Lose Your Memory in 100 Ways. It's available at Amazon. The website is dementiaexpress.com. Go to our website, thisweekinamerica.us, and link on. And let's go back to how this whole thing came about. And this really became an idea for you as you're dealing with your patients on an everyday basis, trying to help them eliminate some of the brain loss, the memory loss that we all seem to have as we get older.
Yes, this whole idea was very real to me because one day I was on July 4th driving through the deep, dark rural area of South Carolina where my practice is, and I brought a car which did not have a GPS on it. And suddenly the same road which I have been traversing every day with a GPS became a nightmare for me. I was like, I don't know this road. I don't know when to turn. And then I realized that it was me about 10 years ago when I drove all the way from New York to Tennessee using a map. And now because of GPS, I've lost that functioning of the brain in which, not having a GPS makes me uncomfortable.
Well,
So that's it.
yeah, and
That's
it's interesting in dealing with the patients, you were seeing signs that modern technology I don't want to say it's a problem because it's really been a blessing the way modern technology has assisted us, but are we too reliant on technology and less reliant on using our brain to figure things out?
Yes, absolutely. Because if you look at it, simple skills like handwriting, people don't realize it, but handwriting is one day going to go away as we are more and more reliant on typewriting. So as we are typing, we are losing, you can already see, you don't see people with very good handwritings anymore. My handwriting is lousy too, but I mean, we are all typing. So ultimately, technology is nothing but outsourcing our brain to do the job which our brain was designed to do. And when we outsource these jobs, our brain's gonna slow down.
Well, when you decide, okay, this is a problem, I'm seeing it every day. I've lived through this myself with the GPS and the reliance on the GPS. When you decided to write a book, it's interesting. One of the first things you said was, "Boy, you do medical books, health books, they're boring. I need to do something that's going to get people's interest and keep the interest." Talk about the approach you took, because, yeah, a lot of health books are boring, to be quite honest.
Right, because we lecture all the time. We as doctors, that all we do. We talk to our patients, we tell them what's the right thing to do. Same way, when advice is given to us in a right way, it's kind of difficult to digest. So I wanted to write it in a more funny and humorous way that it becomes easy to palate, easy to digest information and yet get the message across people because humor and, a twist usually would makes a boring stuff much more interesting and much more easy to understand.
So you're approaching it from a negative standpoint, like how to go ahead and lose our memory, maybe even faster, and then you take the reverse of that, and that's what we should do to keep the memory. In fact, you say in the book, our brains pay more attention to bad advice than good advice. So this actually is a very effective way to get the point across, isn't it?
Oh yes, because I mean, if I tell somebody, "Hey, let me tell you how to hack somebody's email," it's so much more interesting topic than to advise someone about how to secure your email from hacking.
The book is Dementia Express: Lose Your Memory in 100 Ways. It's available at dementiaexpress.com. Information at our website, thisweekinamerica.us. And of course, the book's available at Amazon. And what you're doing is really giving us some tips on how to improve the memory, how to keep the memory focused. And the people think these are expensive. I see these games advertised and you've got to sign up and pay all of this other. You are basically taking things we do on a daily basis, engaging our mind and keeping our mind sharp.
Yes, Rick, you got the point right, and I'm glad you brought this up because doing Sudoku, doing puzzles is only one part of our brain we are exercising. And there are a lot of stuff we do in our daily lives, a lot of habits we have developed which are actually hurting our own memory. and we don't realize it. And the good news is those habits we have developed over time are so easy to correct, and they are free. We don't have to pay any membership site for it. All we got to do is do a thing little differently. For example, if you go to a restaurant and people tend to order the same stuff again and again because they order the same food from the menu because it's so much easier for them to accept that risk that it's going to be good, and they know it already. But there is a value in trying something new. There is a value in trying and picking out a new item from the food menu. And guess what? You might enjoy it even more. And that does stimulate your brain cells.
It's interesting you talk about, first of all, it's easy, and you suggest something as simple as take a different way into work. We're all mindlessly driving into work the same way every day. Engage your mind, take a different way in. It's not costing us anything, probably not going to take any more time than the normal way that we've been going in, yet it's going to benefit us in the long run.
Exactly. And you're right. Many times it happens, we go to the office, and by the time we get to the office, we don't even remember the drive because we have driven that road so many times that our brain has a fixed memory circuit for us to navigate
Yes.
that road. And by the time we get to the office, we don't even remember what really happened on that road. But if we take a different route, it makes our brain think, our brain analyze, try to make sure we are on the right track, and try to, new road will expose you to new visuals. And all those things, little things add up to give a good exercise to the brain on your way to work, and it doesn't cost us anything.
The book is Dementia Express, Lose Your Memory in 100 Ways. It's a humorous book. It's a book that's very logical. It will get you to think, and I guess that's the whole purpose of the exercise. The book's available at dementiaexpress.com. You also talk about no time, no problem. So many of us think, especially with exercise, I have to set aside time for exercise. And this basically is just doing things a little bit differently in the course of our normal lives.
Yes, because really, Rick, there is no time. Let's admit it. We are in a very fast world nowadays. We are connected with technology. We get home, the work comes home straight with us, the emails follow us, and we really don't have time segregation which we can do to put in for exercise. And there is so much to do. You got to take care of the kids, you got to play with the kids, you got to do your daily chores at the home after you come back from the work. So if we try to separate a specific time to do our brain exercise, it's never going to happen. So the best thing to do is while we are doing things on our usual daily life, that's the time to exercise our brain. If you are at home, you come home, you see that something is not fixed, go on to YouTube, go on to any other, take a book and try to repair it yourself and see. That by itself is a great exercise, and you got one of your work done too.
I mentioned the fact that you don't have to spend a lot of money. There are books out there, there are programs out there that are advertised. Again, this is basically doing things in your normal everyday life. They're all outlined in the book, Dementia Express, and you take it from a negative standpoint. For example, the best retirement is early retirement. That's if you want to lose your memory, that's the way to do that. But the end of each of those, you've got a brain booster. And in this point, you're talking about don't retire early. Do you see that often in people, especially the patients that you have, that suddenly they're not as sharp as they were when they were working because they just there's no stimulation there?
Yes, Rick. I'm an internal medicine doctor. I see patients every day, anywhere ranging from 18-year-old to 85-year-old. And I do see these separate demarcation. Patients come to me happily at the end of the day. They say, Doc, I'm going to retire in 1 year. And then they eventually retire. When I see them back again in my office, I can actually see that decline. When people retire, they kind of lose a lot of brain exercise they've been getting at work. Yes, work can be tiresome, but once you retire, that schedule goes missing. People stop remembering what date it is today. They stop remembering whether it is Tuesday or whether it is Sunday, which matters more when you're working than when you're not working. So we do see a great decline in people when they retire. And then I have another subset of patients who are very active after retirement. So they would retire from their regular job, but they are going to do something which they really wanted to do. One of my patient, he started volunteering at the hospital and at the church. And he's doing very good because now he's socializing, he's doing what he wants to do, and he's happy. But if the retirement would end up making people sitting on their couch and watch television, Now, that's not a great thing to do because we do see a big decline in patients, not only in terms of their memory, but also in terms of their health.
This is probably a very broad generalization, but I will ask anyway, and we can discuss it. People are concerned about dementia. There are just millions and hundreds of millions of people that are impacted by this. Is memory loss inevitable? Can we hold it off by changing our habits?
Great. That's a great question because, yes, we can hold it off memory loss by doing brain exercises. And which does not mean just doing puzzles and stuff because that is only one part of your brain being activated. But if you look at the whole situation, what happens is that people who stop doing brain exercise are going to slowly lose their memory. But people who continue to engage their brain in various activities would lose their memory, but slowly. So hopefully that memory loss won't be as severe that it affects our daily lifestyle. So we can hold it off, uh, a memory loss just by engaging our brain properly.
One that you talk about is public speaking, and I guess that's like what one of the first or second like natural fears that all of us have. And I guess what you're saying is what sometimes that fear is not all that bad. It helps stimulate us because we have to think our way through the situation.
Agreed, totally agreed with you. I remember my days when, in my first debate competition in high school, I went onto the mic and I started speaking, and I had nothing to say. I was totally frozen with fear. And but slowly I've practiced and practiced and practiced and I've become good at it. So yes, public speaking is considered to be the most feared activity, even more feared than death. But it is one of the activities which gives you the best exercise of your brain. So if you get a chance to speak, speak up.
How about from your standpoint? I mean, you're seeing a number of patients every day. You've got to listen. You've got to think through what it is they're telling you. So it's like a puzzle. What every day when somebody comes to you, and in most cases they're coming to you because there's a problem. Does that help keep your brain young just by listening and thinking through all the different problems your patients have when they come to see you?
Well, medicine is very interesting field to be in, and I'm so glad that and thankful that I'm in medicine because every single patient is almost, is a mystery box, and you have to slowly unravel that history. So when we are talking to our patients, we are basically trying to get clues to find out what really is happening, and that's how we make our diagnosis. So that's actually a very good exercise, and that's how I would recommend. I mean, riddles, even solving me- problems of your family members. Go and sit down with your family members and talk to them about their problems. Give them some advice. One, they would be very thankful to you. Second, you will be very close to them. And third, you gave your brain an exercise.
The book is called Dementia Express. The website is simple, dementiaexpress.com. Back with us on the program, Dr. Sandeep Grewal. Our information available at our website, thisweekinamerica.us. And you mentioned exercise and walking and with family. Again, people think for any type of exercise to be beneficial, we need to do a lot of it. And you're talking about just go out for a walk. It's going to help you physically. Chances are it will help you mentally as well.
Definitely. And we don't have to do a lot. We really don't have time. There's so many things to do during our daytime. We just have to do it differently so that we can exercise our brain. A little exercise I can give it to our listeners. Many of us do not climb stairs. And if you try to climb stairs in your office or maybe go down the stairs, you will find that you're kind of off balance at first. It's not as easy as it used to be. But you make a agenda that you are not going to use the elevators for a week, and you try using the stairs every day, and you will realize that you can actually run through the stairs without any problem. So that's how agile our brain is. That's how plastic our brain is. When it is exposed to an activity, it is going to develop circuits to make it do it faster and more efficient.
We spend a lot of time, probably more than we should, in front of the television set. Is it possible to spend time in front of the television set beneficially, where we're thinking and exercising, stimulating the brain?
Yes. Uh, Now there are some things in television which are very good for you. For example, quiz shows, any shows which is asking questions, and the idea is not just to watch them, but try to participate in them by trying to guess the answers earlier and faster. So there is a lot of shows on the television which can be very good for the brain.
Got a couple minutes left in the program. Everybody, not everybody, many people getting away from the newspaper. We don't have time for it. I'm going to pick up my tablet, go to the internet, and get stories when I want them. And you really talk about the newspaper, and there are a lot of sources there that get you to thinking, stimulate the mind, and are very good from a brain stimulation standpoint.
Yes, newspaper reading or news reading and being up to date with what's happening currently. And I don't mind if it is, paper newspaper or on your tablet, but uh, when we read news and we keep it updated with what's happening in the world, it increases our general knowledge. Our brain is forced to retain those general knowledge tidbits in our brain, and this is a great exercise,
The
and it
book,
doesn't cost anything.
exactly. DementiaExpress.com is the website. A minute or so left in the program. You talked before on the program about finding a doctor, someone in your particular area in Charlotte where you can go to, you sort of establish a baseline in dealing with these people. Even if you're healthy, you should see a doctor, correct? At least go in and get some tests from time to time.
Yes, very great point you have brought up because high cholesterol that can cause dementia by clogging our arteries in the brain, and that can be prevented if we go to a doctor earlier and get our cholesterol checked and treated so that it does not clog our arteries. Same thing, diabetes and high blood pressure, which increases our risk of strokes. And because it increases our risk of strokes can cause what we call as a multi-infarct dementia. Little strokes all over the brain can make us lose our memory and cognition. So yes, going to a doctor and getting treated properly and even preventing certain diseases from happening can help us avoid dementia and help us keep our brain healthy too.
Is it possible to create new brain cells?
Not really. Research shows that brain cells cannot be created, but memory exercises are more about creating new circuits in the brain rather than, it's more of reorganization of the brain into new circuits rather than creating new brain cells. We cannot create new brain cells, but we can lose the brain cells. And that's what we don't want to happen.
It's a fascinating book. It's very easy to read and so many ideas in there. And it's like, I can do this. And it's just basically setting aside some of the modern technology and thinking a little bit and might very well be able to put off memory loss. It's not necessarily inevitable. Dementia Express is the name of the book. DementiaExpress.com is Dr. Grewal's website where you get information. The book is available at Amazon, Barnes & Noble, information at our website, thisweekinamerica.us. Dr. Grewal, thank you for joining us on the program. Always a pleasure. Look forward to having you back on the program. It's an excellent book. You'll be able to help a lot of people.
Well, thank you, Rick, for having me on it.
It's always a pleasure. And again, the website is DementiaExpress.com. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.